Okay. Hello friends. Once again we are going to resolve another mystery of the anatomy, and that is the liver segments. Okay. These are the functional segments of the liver. The liver divided into different segments, and the knowledge of these segments is clinically important for the surgical procedures, or even radiologically. Now we can identify the different segment and we can isolate the pathology in this one. So this is the functional segment of the liver on an anatomical basis. This is the general picture of a liver, where we can see the anterior, right lateral and superior surface. Liver has 5 surfaces and a falciform ligament, and this purple color is indicating the ligamentum teres. This is the falciform ligament. This is the falciform ligament, and this is ligamentum teres. Now you can see a green color structure that is supposed to be tip of gallbladder, or fundus part of the gallbladder. One structure which is lying here above, this is going above the liver, piercing the diaphragm and entering into the right atrium of the heart, that is the IVC, inferior, I'm sorry, it should not be there, IVC, inferior vena cava, in alignment of the gallbladder. I am drawing here, not in alignment of this one, inferior vena cava, which is passing behind this liver, and many hepatic veins opening into this one, that is IVC, inferior vena cava. Okay. Now, the segmentation of the liver is based upon some imaginary planes or fissures, supposed to be fissures, and a few visible fissures. Okay. The majorly these are longitudinal fissure which is dividing the liver into different parts. Okay. Now first of all, if I can draw this one, there is a main portal fissure, and this main portal fissure is supposed to be an imaginary plane which is going from tip of the gallbladder up to middle of inferior vena cava. We can suppose here is the tip of the gallbladder, and this is the midpoint of the inferior vena cava, and that is denoting to the middle hepatic vein. Suppose this is draining here. This is middle hepatic vein. Okay, this is middle hepatic vein. The first plane, which is known as main portal fissure, is from gallbladder. Suppose here is the gallbladder, and up to the middle of the inferior vena cava, and it indicates the middle hepatic vein which is opening into the inferior vena cava. We will talk later on which hepatic vein drain to which segment. Okay, number 1 is this one. When we talk about the second one, there is the left portal fissure, and this is supposed to be a fissure which is starting from falciform ligament. This is the falciform ligament, this is the left triangular ligament. In midway between them, this is imaginary, and it is running toward the confluences of the left hepatic vein. The confluences of the left hepatic vein. This is supposed to be the left portal fissure, which is supposed to be drawn from the midpoint between the falciform ligament and this left triangular ligament. If I can draw here, I will draw like this one, midpoint here, and this will go up to the inferior vena cava, where the confluences of the left hepatic vein and middle hepatic vein is there. Okay, that is the left lateral fissure. Okay, now right lateral fissure is this one. This one is supposed to be a right lateral fissure. If we can see this one, this is right lateral fissure. And how it is drawn? It is supposed to be drawn from the notch of the right side, and this is this having a most variable fissure, and where the confluence is the right hepatic vein with the middle hepatic vein, okay, that is supposed to be or up to the inferior vena cava, this is supposed to be another longitudinal fissure. Now these fissure dividing the liver into different parts, okay, each fissure. Now how this horizontal line is drawn? The Gleason's capsule of the liver forming a sheath which is dividing almost each part, okay. This is supposed to be a part. This is the right hepatic vein. This is the right hepatic vein in right lateral fissure. Right lateral fissure. Now this segment, this is divided into different segment. One segment is liver, another segment is this one, then this is the segment 3 segment. Okay, this liver is divided into different segments, okay, different part. Now each part of the liver, almost each part of liver is divided by the Gleason's capsule into 2 parts. Okay, we can see this is the single part which is lateral, this is lateral to this right hepatic vein, which is divided by the Gleason's capsule. Okay, I want to draw a green line to denote this Gleason's sheath of the liver. This is divided into. Then there is right medial. Right medial. This is again divided into 2. Okay. Then okay, this one, and there is, if there is a sheath, this is again divided into 2 parts, except the one which is left lateral most, okay, left lateral most, and a one very minute which is behind this one. This is caudate, okay, caudate segment. Okay, now we are going to divide into different segment. How we are going to consider this segment? Very simply, I want to revise that by this longitudinal fissure, liver is divided into different parts. Some other visible fissures are there, as there is an umbilical fissure which is supposed to be groove for the ligamentum teres. Okay, the fissure venosum, that is almost in the alignment of this one, and fissure of Gans which is supposed to be found in the gallbladder fossa. These indicate the caudate lobe, etc. But by this help of these 3 fissures, that is the main portal fissure, the right lateral fissure and the left lateral fissure, the liver is divided into different parts, and each part almost having 2 segments which is separated by the Gleason's sheath. Overall, the 8 functional segments of the liver are considered. In 1957, the Couinaud classify them as a hepatic segment. Some other research worker also. So this is known as Couinaud classification. Okay, this is supposed to be a Couinaud classification, but some other research worker added some additional information to them, and then later on this is supposed to be a 9 segment. Revert back, and it's again the 8 segment. How we are going to enumerate this segment? We write it from left lateral one. We consider that this part is left medial, this is the left lateral. That means which is lateral to this left hepatic vein is left lateral. Then this is the left medial, right medial or right anterior, and right lateral or right posterior. Lateral is also considered as posterior because in the 3-dimensional structure, lateral aspect of liver is running toward the posterior aspect. So the right lateral, the right medial, the left lateral, the left medial, both left medial, then there is a right medial and right lateral. These part of the liver was divided by the longitudinal segment, or almost all the segment divided into 2. The right lateral part is divided into 2 by a Gleason's sheath. The right medial also, or right anterior, is also divided by the Gleason's sheath into 2. Then the left anterior or left medial is divided by the Gleason sheet into two, except one segment, which is left lateral most segment, is single segment. Okay, now we are going to give a numerical value of these segment. Okay, this is supposed to be the segment number 2. Simultaneously, I am giving the numerical value into this segment. This is segment number 2, and between this there is segment number 3. Similarly, this is segment number 3. Okay, this is segment number 4. That means third and fourth in the left anterior, left medial. The second is left lateral. Okay, then segment number 5 in the segment number 5 in the right anterior or right medial. The segment number 6, that is right lateral lower part. Segment number 7, this is the way how they are having the numerical values. And segment number 8, which is upper part of the right anterior one. Second, third, fourth, fifth, sixth, seventh, eighth. In a anti-clockwise manner when we are considering a portal vein, or if I am looking from the front, that is a clockwise manner. Second, third, fourth, fifth, sixth. One is lapsing, that is first one, and we enumerate this one, that is the caudate lobe, which is representation of the caudate lobe, which is behind the fourth. Behind the fourth, that is the first one. This is the first one. This is the fourth one. This is the fifth one. This is the sixth one. This is the seventh one. Okay, and this is the eighth one. Now we are very familiar that the left lateral is second segment. The left medial is third and fourth. The right anterior is fifth and eighth, and the right lateral is sixth and seventh. These are the 8 segment of the liver. Now, why we are considering these segment? On the basis of this fissures and Gleason sheet, okay, we can understand the division of the hepatic vein or supply of the hepatic vein, as well as the supply by the portal vein. Drainage of the hepatic vein as well as supply of the portal vein can be different into these parts. And as well as the arterial supply of the liver is also according to the segment. We will discuss here. First of all, these 8 segments. Now, I think we are very familiar. These segments. This is the main portal fissure, right lateral fissure, and the left lateral fissure in between them. This is separating, and each segment is divided to except one second, left anterior. Now we are familiar with the numerical division or numerical nomenclature of this segment, which is starting from the left lateral and going in this way. Now I am giving the demarcation, or I am telling you about the hepatic venous drainage, which is opening. Usually there are 3 veins. One is running in between the right lateral, or this right lateral and right medial one. Okay, whether you know right lateral or right posterior, or this is right anterior, right medial one. This vein is the right hepatic vein. Okay, right hepatic vein is draining to the segment number 7, as well as the segment number 6, segment number 5, and segment number 8. Okay, right one. The middle hepatic vein is draining adjacent one, and this is also draining the 8th, the 5th, and the 4th. Not the first. Not the first. Okay, every adjacent, but not the first. Okay, now we can see the right anterior or segment number 8 and segment number 5 are drained by both right hepatic vein as well as the middle hepatic vein. Now, if I am talking about the left lateral vein, which is running like this here, this is draining again, this is draining here, giving 1, this is also draining 4, and then going and draining 3rd and 2nd. third and second. Suppose this is third and second, the left lateral. That means the segment number 4 is having dual drainage. It is drained by the left lateral as well as the middle hepatic vein. Left hepatic vein as well as the middle hepatic vein. The adjacent to inferior vena cava, all the segments, whether the segment number 4, segment number 8, segment number 5, these having the dual drainage. What about the first? Very, very special. This is drained by a single vein usually, that is known as lower vein. Lower vein of this having a single vein drainage, that is caudate lobe. First segment is drained individually into the inferior vena cava. That is the drainage system of different segment. The segment number 2, segment number 3, segment number 4. Segment number 2 and segment number 3 are exclusively drained by the left hepatic vein. The 4 is drained by the left hepatic vein as well as the middle hepatic vein. The first having individual venous drainage. Now the middle hepatic vein draining 8th and 5th with the right hepatic vein, and right hepatic vein exclusively draining to the 7th and the 6th and the 7th. This is the venous drainage by the hepatic vein and all the hepatic vein draining into the inferior vena cava. I want to remind you once again, the hepatic vein opening into the inferior vena cava, anchoring the liver in the upper part of the abdomen, in the roof of the abdomen. That is one of the most important factors. One of the most important factor which is holding the liver in its position. Okay, now coming toward this diagram, behind this there is the portal vein. Okay, this is the portal vein. This is the portal vein, which is dividing into a right portal vein, and a left portal vein. That the right portal vein, this is the right portal vein, and this is the left portal vein. This is the left portal vein. Both the portal vein give their venous drainage to the caudate lobe. The caudate lobe and segment number 1st was drained by the individual hepatic vein. Okay, these are points to be remembered. But the caudate lobe is supplied by, this is the portal vein. This is the portal vein. Portal vein is divided into this, giving this is supplying the 8th, the 5th, the 6th and 7th, and that is the right one. And right before giving supply to the 8th and 5th, and is giving an individual branch or supplying the caudate lobe. Both left and right portal vein giving a branch which is supplying the caudate lobe. Okay, or segment number 1. Left one giving this one and supplying all the segments which belongs to the left lobe. Okay, that was the distribution of the portal vein. The portal vein distribution was easy. Portal vein was divided into left portal vein, right portal vein, and then they are sequentially supplying the segment in a very easy way. Except the segment number 1, which is caudate lobe, and this is supplied by both right and left portal vein, right and left branch of the portal vein, right and left branch of portal vein. Here is three different hepatic veins. Additionally, one individual vein which is draining the caudate lobe, and the nearby segments are having the dual venous drainage. Okay, that was the hepatic difference between the hepatic venous drainage and portal vein supply of these all 8 segments. Now, I am coming toward the arterial supply of these segments. Look at this one. I want to draw just a simple diagram without a nomenclature. I want to draw just a simple diagram to show you the arterial supply of these segments. When we are talking about the celiac trunk, suppose this is the celiac trunk giving rise to the left gastric, giving rise to the splenic artery, giving rise to the hepatic artery, It gives rise to the gastroduodenal artery, right gastric artery, etc. And then is forming the hepatic artery proper. Hepatic artery proper, which divides into two branches on a right side and a left side. The left branch giving three branches, segment number 2, segment number 3 and segment number 4 are supplied by this left branch. Now as we move in, the right hepatic artery, first of all it giving a cystic artery. This is the same artery which is on the Couinaud triangle. We have to ligate before cholecystectomy. And after this is giving the divide further and this give rise to the segment number 1. That is, now this time the caudate lobe or segment number 1 is supplied by the right hepatic artery. Then nearby the segment number 5 and segment number 8. The segment number 5 and segment number, segment number 5 is going below, and segment number 8 by this branch, and then onwards we can say that this is segment number 6 and segment number 7. Segment number 7. 1, 2, 3, 4, 5, 6, 7, 8. 8 segments are supplied. This is the hepatic artery proper. Hepatic artery proper. And this is the cystic artery. Cystic artery. That means the hepatic artery divides into the left side hepatic artery, the right side hepatic artery. The left side is supplying to the segment number 2, segment number 3, segment number 4. Okay, but not the first again. But when we talk about the right hepatic artery, that is first of all giving branch to the segment number 1. Now this time it's partial. The segment number 1 is supplied by the branch of the right hepatic artery. Additionally, the fifth and eighth segment is also supplied by this branch. Further a branch is given which is supplying to the 6th and 7th segment. That is the again difference between the arterial supply. So you can see the segment which was divided vertically by the fissures. Main portal fissure, right portal fissure, left portal fissure into the right lateral or right posterior, right anterior, right medial, left lateral, left anterior, then further divided by the Gleason capsule, and in a particular pattern these are having a numerical value from 2nd, 3rd, 4th, okay, again 2nd, 3rd, 4th, 5th, 6th, 7th, 8th, and 1 which is supposed to be caudate lobe always, okay, no change till date. This is a different pattern of the venous drainage as well as the portal vein supply and the hepatic artery supply. Why I am saying the portal vein supply? Portal vein having a specific feature, it giving a nutrient to the liver to perform its function. Okay, first of all, this is the hepatic drainage. I want to write it hepatic drainage. This is the hepatic drainage. Hepatic drainage. And this is the portal vein supply. The portal vein which is divided to left and right. The left one supplying the 4th, 3rd and 2nd, additionally giving a 1 vein to supply the caudate lobe. Similarly, right also. Then the right one supply the segments of the right side, functional right side, and the arterial supply. The first is neither having individual artery nor having a contribution by the both. It is supplied by the right side hepatic artery, and I want to remind her that the caudate lobe is not supposed to be a part of the right lobe now. Okay, that is a particular thing that is not supposed to be a part of the right lobe. This information, this is just a two-dimensional picture of the segment. This is information because the segmentation is the specific for any interventional the treatment of the liver is very important for the clinician to identify these segments, especially in the radiograph, CT scan or ultrasonography of the liver. Also we can identify the segment as I can assume there is a lobe, the fissure of Gans, that is the gallbladder fossa, and the umbilical fissure, which is supposed to be fissure for the ligamentum teres, and above porta hepatis. If I can see this one, that is the quadrate lobe. We can identify the quadrate lobe, which is behind the segment number 4, and it is individually supply the vein. This type of information is very, very important clinically. Okay. Thanks for the patience-full hearing, friends. I think you will like this topic and share more and like my videos. Thank you.